Once considered a rare disease, diabetes, the number of people battling diabetes is increasing greatly. According to the CDC website updated in 2007, there are more than 23.6 million people affected by diabetes in the United States alone. When out of this 23.6 million, there are a lot of people that are unaware that they have diabetes. In 2007, the CDC website reported that 5.7 million people are unaware that they have diabetes. So what is diabetes exactly? Well, diabetes is, today I would like to inform you about the nature and treatment of diabetes. I will begin with the nature. Diabetes is a chronic condition with many complications. When I say chronic, it's for life. Diabetes will never go away. As described by the American Diabetes Association website in an article titled Denial, many people have denial the first few months of their diagnosis. With these complications, they can have high blood sugar spikes, can catch up with you in the long run if you don't take care of them. According to the Understanding Diabetes published in 2002, the three main areas affected by diabetes are the eyes, kidneys, and nerves. With the eyes, they start going blurry and you can't see anymore. And the kidneys, once they start shutting down, you'll have to go in for dialysis, which is a machine that you get hooked up to and it pumps fluid through your kidneys to clean them out. And the nerves, you start losing sensation in your hands and your toes. And once that happens, you'll usually amputate your arms or your legs. Blood sugar is a key role for taking care of this. According to Understanding Diabetes, published in 2002, even though good control of blood sugar isn't the only factor, studies have shown that good blood sugar control increases the chances of not developing these complications. Now that you have an idea of diabetes, next I will explain the symptoms. There are many symptoms in diabetes, and some of them are excessive thirst, dry mouth, and prolonged headaches. According to Coping Diabetes, published in 2002, many people are unaware of these symptoms and may go undiagnosed for a long amount of time. With these symptoms can come any complications if they're not taken care of, and a great responsibility for keeping your blood glucose ranges in range. And it's important to go to the doctor and make sure that to get checked for diabetes, just in case you would have it. Now that you have heard about some symptoms, next I will explain the pancreas. The pancreas is a defective part of diabetes because that's the reason why you have it. There's three important cells that keep it working smoothly, and if they stop working, this is why you get this condition. According to Coping Diabetes, published in 2002, the alpha, beta, and delta cells work together to maintain the amount of glucose needed. Once food is digested, it is turned into glucose or sugar. And when it's, as described by the Mayo Clinic website in an article titled Type 1 Diabetes, updated June 13, 2009, once glucose enters the bloodstream, your blood sugar level rises and the body signals the pancreas to produce insulin. Once insulin is secreted, it is absorbed by your muscle and fat tissues, and then your blood sugar lowers. Keeping these points in mind about the pancreas, next I will explain the treatment. There are two treatment options for diabetes, or there's one treatment option for diabetes, but two ways you can do it. You can either give it by syringe or you can have a pump. And a syringe is discreet, so nobody knows that you have diabetes, and you have to draw up the insulin from a vial manually. But the pump, on the other hand, has two vials inside, and it's about as big as a cell phone, so it hangs right on the side of you. And from there, it has two tubes coming off of it and a catheter at the end. As described by Medicine Net website in an article titled insulin pump for diabetes mellitus, updated in 2007. The catheter is inserted just below the skin, usually on the stomach, and gets changed every 2 to 3 days. With this pump, it acts as a fake pancreas, so it gives you better insulin control. In conclusion, millions of people have diabetes, and the number is still rising today. Diabetes is a chronic condition, so it needs to be taken seriously. Luckily, there is a treatment option. No one knows for sure if there ever will be a cure, but hopefully in the near future there will be.